There is still a lot of taboo around mental health issues in our country. When someone suffers from a knee pain or backache, we recommend them to go see a doctor and seek medical help. But unfortunately, a person's emotional struggles are often overlooked or judged or even ridiculed at times. To speak about emotional challenges that a woman with PCOS faces, I have with me a brilliant psychologist, Ms. Seema Hingorani. Seema, thank you so much for sitting down and chatting with me.
No, it's trust me, my pleasure coming here. Anything for mental health awareness.
Now, Seema, talking about PCOS, there are a lot of epidemiological surveys that state that in PCOS there is an increased incidence of depression and anxiety. I feel like being diagnosed with a chronic condition itself could cause huge mental upset. So what sort of complaints do adolescent girls who've been diagnosed with PCOS come to you?
There are times when girls say at about age 14, 15 to say 24, 25 or even 30 they come to us. And they will have symptoms of depression, feeling low, low self-esteem, body image issues, anxiety, palpitation. And then while taking the history, we suspect that there is a history of PCOS as well, because first question that we ask, how your menstrual cycles are, and they say, oh, I've not had my chum since past 3-4 months and I've not done anything about it. And that's alarming, you know. I said, oh, okay, you have not visited a gynecologist? And they say no. So they come to us with symptoms of depression, but we identify this as a part of depression and then we refer the case to a gynecologist. So then the depression is taken care by me through psychotherapy, but the period cycle PCOS is taken care by the gynecologist.
What would you say are the signs of someone experiencing depression?
So usually we have many girls who come and say that, you know what, doctor, I'm not sleeping well, I'm not eating well, I'm spending most of the time crying, I'm running away from my family, and then they start, sometimes in the extreme cases, they start getting very, very strange suicidal thoughts and then they get scared.
So it goes to that extent?
It can go to that extent if it's not treated, because as depression, the serotonin levels of the brain is also dropping, as well as your hormonal changes of not getting your chums on time, the cycles is also going haywire, making the person feel that they are going out of control.
So serotonin is a neurotransmitter that makes you have positive feelings.
Absolutely, positive thoughts, positive feelings, and that kind of drops.
But see, the most important issue here, and I feel which is very ill understood, is that craving sugar or inactivity, you know, not being able to motivate yourself to work out is a part of the pathology of PCOS.
Which is actually very unfair because no one knows the condition very well.
Correct.
But the judgments are very strong, and that puts the motivation factor totally, or, you know, oh, my parents are judging me, so let me not do anything about it.
Correct.
Another symptom to highlight is they feel very angry and very agitated.
Can you please take me through a treatment protocol?
So firstly is we make sure that they go to a gynecologist, or if we get the case referred by the gynecologist, then it is in working with two doctors that are working in tandem with each other. But my work as a psychotherapist is to make sure that their negative belief is not triggering the PCOS. So negative belief maybe I'm not good enough, I'm ashamed I have this problem. Like I said, body image is a huge issue that I'll never be able to date. So I target these negative beliefs, and my treatment protocol is to basically shift these negative beliefs, reprogram them into positive beliefs. Having said that, it's not as simple as it sounds. We do a lot of work with where are these negative beliefs coming from? Is there history of PCOS and depression in the family? Did the mother have history of postpartum depression? What are the attachment styles in the family? Is the family dysfunctional? Is this person, the young girl who's coming, having dysfunctional relationship with a romantic attachment with a boyfriend? All variables go together. Let me simplify. We see the stresses, the daily current stresses. I jot that. I jot the negative beliefs, and I go back to the past traumatic memories of the client and help them to process that. So we call it reprocessing of the traumatic memories, because I'm a trauma expert as well. That is where my super speciality comes in. So once we start reprocessing those traumatic memories of unhealthy childhood or bullying in school or not having good relationship with the peer group, that with your current stresses, I give them a self-care protocol and they have to follow that.
So are these a combination of, say, behavioral techniques and a worksheet?
Many cognitive behavior therapy worksheets, home assignments, a lot of techniques which are done in the clinic there and there only, which helps them to identify what are your own emotional parts of personality that are getting triggered. So triggers, basically, where do you get triggered? And understand the condition of PCOS better, give them psychoeducation of the connection between psychological output and PCOS, so they can handle it themselves better. Like going for a walk. It sounds simple, but many of them can't. So have a weekly journal of, let me go for my walk today. Check.
Like a habit tracker.
Eat healthy, eat every 2 hours, checklist. What was the consumption of sugar, flour, that's maida, we don't allow that during depression. Have you taken your multivitamins? Did you express your thoughts? Because we always feel that when people don't express their thoughts and emotions, PCOS, migraines, anything, skin disorders, everything worsens. We keep checking with them. So, and we teach them how to check with themselves. What am I feeling right now? What are my emotions right now? Why am I eating this one piece of sweet, but why am I having 3? And then slowly the body starts restoring, repairing, and then body starts coming back to normal.
Let's talk about how much do you involve parents or a patient's friends, into this therapy?
Question. A lot actually, especially with young girls of 14, 15, where the relationship is anyways very tumultuous because of the hormones and mood swings a teen goes and the dating thing. So usually the mother will come and say she doesn't understand me, she's very rude to me. So we give a lot of psychoeducation to what is actually happening to your teen and how this will settle down and how the attachment between a mother and daughter or daughter and father also needs to be more secured. We tell the mother, please don't go giving advices, ye khati nahi hai, ye aise nahi karti. Don't do that. Hear your young teen out. Hearing so they can express more. So what we do is we do a lot of expert techniques, but in the family also you need a safe, secured environment.
Seema, let's talk about infertility. Now, sure. Infertility due to PCOS could also be a huge stressor in a couple, right? So when they get referred by their OBGYN to you, how do you help them?
So basically, firstly, I understand that with the lady, with the person who is trying to have a child, what are her emotions? What is she feeling? And usually you will have an emotional meltdown in the clinic. So we allow that emotions to flow. Second thing, I have a lot of couples coming together and I understand that how it is affecting their relationship. And sometimes the therapy room is a safe place for them to talk about their marital problems that's surfacing up because of infertility. Pressure from joint family, uncles, tayaji, ye, wo, in-laws. Still in India these things do play an important role. So a lot of things that are suppressed in the couple usually comes out and we address that. So that the person who wants to conceive is stress-free. That is what we are looking at. So infertility, PCOS, and then where I come into the picture is dealing with all the emotional baggages that this person is going through. So I had a recent case where a girl came with her husband and she's trying to conceive and she's not conceiving because she's got PCOS, and unfortunately, one of the family members told her that, she's got some huge problem, disorder, and she'll never be able to conceive. And she was very taken aback and very hurt. And it was just PCOS and it can be treated, So she was sitting with all that hurt and grief. So I was telling her how to cope with it and how people in our country don't have, much management skills with this or understanding of the problem area. So all these small issues, Dr. Sashi comes up. But they pile on and they become big. Right. Then we also tell the husbands how they can be a little more supportive in not bringing up PCOS again and again. So if you go too much into that, also that causes a dent in the mind that I have a problem. So this is where I come into the picture, addressing emotions, thoughts, feelings, and how they both can be supportive with each other. See what happens with this treatments and PCOS. Anxiety is very high. Your person is nervous. We call it low-grade anxiety. So it may not be very visible when you meet a person, but she feels that somewhere in her.
Can you just tell me what is anxiety per se? Because a lot of people confuse it with fear.
Right. So clinically, anxiety has a physical manifestations of feeling nervous very easily, not able to maintain eye contact, very restless, and dry mouth, sweating in the palms. Feeling out of control, because many people don't realize, but we research, so we know that they don't have a physical manifestation of heart racing and heart pounding, but they have mind anxiety. Mind anxiety is constantly ruminating thoughts about what happened in the past, somebody told me that, and these are stuck record thoughts. It's like, I call them monkey chattering. So I said, do you have monkey chattering in your brain? And they said, what? And I said, do you feel that your brain is heavy all the time, your mind is heavy all the time, and then you have neck pain and backache? And I said, exactly, this is happening to me. I said, this is anxiety. How? This is anxiety? I said, absolutely, you're feeling anxious. This is mind anxiety. So these both anxieties are related to generalized anxiety disorder.
Then do you give meditation or mindfulness techniques to these people?
A lot of them, yeah. We do a lot of mindfulness meditation techniques. We do a lot of research techniques where we tell them how to relax the nervous system. First thing, we make them aware where it's coming from. Do they have an anger problem? Is somebody in the family got anxiety? Sometimes parents have anxiety and we take it on. We see that it's a learned behavior. So my job is to make them unlearn. So that's anxiety.
Let's move on to menopause. Now, PCOS is a condition that is a lifelong one, right? So, and in menopause, there are added challenges any which ways. Now, add to that a metabolic complication like diabetes or hypertension might put a lot of psychological pressure on a woman.
Definitely.
So, when women come to you around the perimenopausal age, what are the commonest symptoms and how do you deal with them?
I'm increasingly getting clients every year, say, rise by 10, 20, 30% of a lot of women coming to me with perimenopausal. So, they're aware of menopause, but they are not aware of perimenopausal symptoms. So they usually say something is not going okay with me. I feel like crying all the time. I'm getting hot flushes. Some women, I got a case where she said I was driving and something was happening to me and I couldn't express what was happening. So she drove aside and she stopped the car. And she was feeling as if there is a heart attack that's coming. So usually they will go to the ER in the hospital, and then they realize that, oh, it was just anxiety, but it's all connected to perimenopause or menopausal symptoms. And sometimes they come and say, "Oh, everything is fine in my life. My children are doing well, and emptiness syndrome and children go away for further studies." That is time menopause hits further because you feel that, oh, I had so much to do and nothing to do now. You're not needed anymore. My husband is busy, my children don't call me. So small things, they start crying and they become sensitive. It is such a stigma still to say, I'm depressed. People don't want to say I'm depressed. They won't want to say I'm seeing a shrink or I'm going to a therapist. And we are hoping that stigma goes away because we tell our clients, do not feel shy. This happens to everyone. It's phase in life, it goes away.
Because acceptance is the key to treatment eventually.
Absolutely, and rather than bottling it up so much and then going into these bizarre thoughts like I explained, sometimes it goes to extreme thoughts of not wanting to live and life is not meaningful anymore. Better go and talk to someone. And better go and talk to a qualified person who can deal with your emotions, because many of these women don't want to even talk to their friends and let them know that they are, because they want to present this facade that everything is fine, I'm doing good. But we're not doing good and it's okay to be vulnerable sometimes. We don't like to be vulnerable.
Especially because women want to do it all.
Yeah, we are superwomen, And it's okay to be vulnerable. It's okay to be sensitive. But it's not okay to live in that state of mind continuously, is what I think.
All of us go through difficult times in our lives, no matter which socioeconomic strata we belong to. Stress is everywhere. Everybody's dealing with some kind of an issue.
Absolutely.
Correct. So would you give us 5 suggestions on how to deal with stress in a better manner?
First and very, very strong suggestion is that address the problem there and there. Like, never let it suppress, because many times we feel our problems will not be validated by whomever we have a problem with. So I tell all my clients that never suppress, because that's very dangerous, and there is where depression and anxiety starts building up. Okay. Whomever you have a problem with, talk without getting defensive. So first, address it with yourself. What is the problem? What am I feeling? So addressing emotions and your feelings is the key. Second thing, to reduce stress, never compare your lifestyle with anyone and everyone around. The moment we start comparing without knowing what is actually happening behind the scenes, we are completely going to get distorted in our life. In the sense, we are going to be unhappy. So second thing is to probably say that, okay, whatever it is, whatever challenges I'm going through, it's just a phase, and I, rather than harping and going on saying how bad the universe has been to me and God has been to me, what is my conflict resolution? The moment I look for a solution, and you may not find any solution, it's okay, just hang in there for some time. Solutions come. Many people don't have patience. So the third tip is, please develop patience to whatever you're going through, even if it's depression, PCOS. The more impatient you will get, it's not going to get better. I always tell my clients, if you will be patient and trust in a doctor, then whether it's a gynecologist or whether it's a therapist, that we are taking you on a right track. Because I see a lot of people with trust deficit. Oh, why is she prolonging my treatment? Don't do that. Trust people. Then you will start seeing the stresses are going away. Have friends. Go out a lot. Meet people. Don't be in the locked doors. Go near the beach. Take a walk. All this sounds very cliche, but we need oxygen to the brain. We need to meet people. We need to see happy faces. Be with positive people. Don't be with people who are negative. Don't be with people who put you down. Don't be with people who are jealous of you. And you will get, many people say, oh no, it's very difficult to find positive people. No, it's not difficult. You attract your tribe, you attract your people. So if you're positive, you will definitely, and then nurture that relationship, rather than saying that I have my ego and let her text me or let him text me. No, you feel like talking to people, you text. So these small things, if we keep in mind, we make our life stress-free. Another very important point, and the last point, is that diet is very important. People don't understand the connection between food and mood. If you have too much spicy or too much sugary food, it's affecting your mood. Or remaining hungry, eating healthy diet, and working out is very important. If you can't work out, go for a walk. Keep it simple. Trust me, stress will not hit you. That's strong.
I hope this motivates a lot of people to seek help at the right time and also have open discussions on mental health.
Thank you so much.
Thank you so much.